friends, welcome to my YouTube channel. Today we will learn about one of the most important questions of neuroanatomy, that is circle of Willis, along with its branches and clinical correlation. What is circle of Willis? The major arteries supplying the cerebrum gets interconnected to one another at the base of the brain to form a six-sided polygon of arteries which is called as circulus arteriosus or circle of Willis. The circle of Willis is formed around the interpedunculaire fossa and it lies in the interpedunculaire subarachnoid system. It contributes to most of the arterial blood supply of the brain. This is how a six-sided polygon, that is circle of Willis, will look. The circle of Willis mostly comprises of basilar artery and internal carotid artery. From where does the basilar artery comes? Seeing it from its root, the arch of aorta gives one branch, that is subclavian artery. The subclavian artery gives origin to vertebral artery. Both the right and left vertebral artery combine with each other and give origin to basilar artery. The basilar artery and the vertebral artery gives many branches to the spinal cord as well as to the brainstem. But one branch of the basilar artery, that is posterior cerebral artery, will supply the cerebrum and it will form the posterior side of the circle of Willis. Coming on to the internal carotid artery, from where does it arise? The arch of aorta along with the subclavian artery gives another branch, that is the common carotid artery. The common carotid artery, as it continues upwards, divides itself into two branches, that is the internal carotid and the external carotid artery, out of which the internal carotid artery will form the major portion of the circle of Willis. The internal carotid artery passes through the carotid canal and enters into the middle cranial fossa. There, it gives many branches which will form the anterior and lateral part of the circle of Willis. The first branch is the middle cerebral artery. We can also see an artery arising from the internal carotid artery, that is the posterior communicating artery. The main function of the posterior communicating artery is to connect the internal carotid artery with the posterior cerebral artery, which is the branch of the basilar artery. The second branch is the anterior cerebral artery. The anterior cerebral artery, as you can see in the figure, is on the anterior side and it will supply the cerebrum. You can spot that both the anterior cerebral artery are connected with each other by another artery which is highlighted in green color. That artery is named as anterior communicating artery. Therefore, with the help of these arteries, the circle of Willis is formed. As you can see, that circle of Willis is crossed by optic tract, and when we remove the optic tract, we can clearly see the whole polygon of the circle of Willis. Revising the circle of Willis again, the basilar artery will give posterior cerebral artery, which will form the posterior side of the circle of Willis. Along with the internal carotid artery, the posterior communicating artery will form the lateral side of the circle of Willis. And the middle cerebral artery, which arises from the internal carotid artery, will form the anterolateral side, as well as the anterior communicating artery and anterior cerebral artery, as the name suggests, will form the anterior side of the circle of Willis. What is the functional significance of the circle of Willis? The circle of Willis is mostly formed by the major arteries which supply the brain. What if one artery gets blocked? During that time, the circle of Willis will provide various alternative routes for collateral circulation like an arterial traffic circle. Before seeing branches of circle of Willis, we will first solve some of the MCQs. The first MCQ is, anterior cerebral artery is the branch of? It is the branch of the internal carotid artery. The second question is, Posterior cerebral artery is the branch of the basilar artery. Therefore, middle and anterior cerebral artery arises from the internal carotid artery, whereas the posterior cerebral artery arises from the basilar artery. Branches of circle of Willis. The circle of Willis will give four groups of central branches. They are antero-medial, anterolateral, posteromedial and posterolateral groups. As you can see in the figure, that whole circle of Willis is seen with the highlighted green color arteries, which are anterior and posterior communicating artery. They lie in the interpedunculaire fossa, out of which the anterior cerebral artery will give some of the branches which will supply the cerebrum, and that branches are the antero-medial group. The second one is the anterolateral group. They lie on the lateral side of the cerebrum, and this is a lateral view of the anterolateral group. The third group of branch is the posteromedial group, as it lies medially and arises from the posterior cerebral artery. And the fourth group is the posterolateral group, which is highlighted in yellow color. Hence, we saw all the four branches given by circle of Willis. Coming on to the clinical correlation, the first clinical condition is the congenital cerebral aneurysm. This mostly occurs at the site where the two arteries join in the formation of circle of Willis. The basic abnormality at this point is the congenital deficiency of tunica media, which is the elastic tissue present in the arterial wall. Hence, it is congenital cerebral aneurysm. The aneurysms are mostly berry-shaped. Hence, it is also known as berry aneurysm. The second clinical condition is the subarachnoid hemorrhage. The cause is commonly the rupture of the congenital berry aneurysm in the interpeduncular cistern. The symptoms include sudden severe pain in head followed by mental confusions. Sometimes the death may also occur in this condition. Thank you so much for watching this video. Please do like, share and subscribe to my channel.